Anyone who has diabetes or hearing loss, it should be suspicious, whether that's in a child or adult. Anyone with unexplained strokes or stroke-like episodes or metabolic strokes or unexplained seizures, or anyone with atypical brain lesions, especially in the gray matter, especially in parts of the brain that require a lot of energy, like the basal ganglia, that should make you suspicious. But, there's mitochondria in every cell of your body except for your red blood cells. So it could potentially affect any organ system. So it can present very differently. Heart findings like cardiomyopathy or conduction defects are very common. As we said, endocrinopathies and diabetes can be common. Hearing loss is very common, as we said, but it can also affect the kidneys, the liver, the lungs. It can affect your vision. But some people may only present with mild symptoms like exercise intolerance. The key thing to see is if someone has a metabolic stressor, such as trauma, or has a reaction to anesthesia, or has a fever or an infection, and they have worsening of their symptoms, that is also suspicious as well, because that's how it commonly presents.
So, because it's mitochondrial and the mitochondria are where we get our energy from. So the stressor, so we're requiring a rapid bump in energy. The mitochondria are not able to keep up with the necessary output. And then there's an issue. So it sounds to me like the metabolic stressor is like the key to the story that should point us in that direction.
That is true. And when my son had a number of metabolic strokes throughout ages like 7 to 10, but not all of them were due to a metabolic stressor. But for people with mitochondrial dysfunction, mitochondrial disease, sometimes your body can compensate until it can't compensate anymore.
Okay.
But stressors are more likely to precipitate it.